to cancer survivors, their families, and caregivers. With this event, we've branched out into education about cancer survivorship. Survivor Journeys has support groups, breast cancer, blood cancer, an adult all cancer group, as well as a caregiver program, a mentoring program with national ties, and a pet therapy program. In development is a young adult cancer survivorship group and a pediatric cancer caregiver mentoring program. We have a lot of exciting ideas, but we need your help to get the word out. We also have an expressive arts program that's part of a research project that's starting this summer. We need your help to volunteer, to give us ideas, and we're a nonprofit, to help us with financial support. Because Survivor Journeys is not affiliated with a cancer center, hospital, or government agency. We survive based on the donations of the people who agree with our mission. So why Survivor Journeys? Well, our area is really no different than most areas outside of major metropolitan areas. We need to be able to provide more support services for cancer survivors, their caregivers, and families. We need to create awareness about cancer survivorship. Well, keep working. And we need to educate people about cancer survivorship topics. We need to create awareness among survivors, their caregivers and families, but also medical and behavioral health professionals, as well as the general public. So, a primary goal of today is that you come away understanding the predominant definitions of being a cancer survivor and what cancer survivorship is. The predominant definition of a cancer survivor is when you are diagnosed, because that is when you go into survival mode. You have to learn how to fit cancer into your life, and also how life fits into your cancer treatment. The definition of cancer survivorship is life with cancer before, during, and beyond cancer treatment. You are the ambassadors of cancer survivorship in our area. We hope that you will share this information with people that are not here today, that you learn from our speakers and our vendors. We also hope that you share this information with your oncologists, primary care providers, and mental health professionals. You are what's going to drive cancer survivorship in our area. If I gave this talk in Idaho, I'd be saying the same thing. This is not going to be driven by physicians. You need to tell them you need this information. Until then, Survivor Journeys will be here to help you with that. So why Cancer Survivorship 101? Well, about 3 to 4 years ago, I had a conversation with the director of the Dana-Farber Adult Cancer Survivorship Program. Her name is Dr. Ann Partridge. She's a breast oncologist. And we were talking about all the great services at Dana-Farber. And there are. They're fantastic. But I said to her, I said, Ann, where I come from, we don't even have Cancer Survivorship 101. And that's how we came to this topic. We want to be able to create awareness about cancer survivorship. I can't say that enough. People need to know that this is a thing. Education, that's what we're doing today. It's empowering. There are many more topics that we would have provided today, but this is the first time we're doing it. We wanted to see if the community would embrace us, and you have. This is wonderful. Topics such as chemo brain, sexual health, fertility, financial toxicity, palliative care, just to name a few, are topics we'll address in the future. To educate yourself more, engage your oncologist. It's more than just about treatment. Ask about some of the things we're talking about today. If you're going to go to the internet, please use reputable sites. Example, National Institute of Health, National Cancer Institute, hospital and cancer centers that you know will give you good information. We also want to build a collaborative local cancer survivorship community. The vendors here are great. If you're part of an organization that's not here, they either declined or they haven't collaborated with us in the past. I'm hopeful that with this turnout and your input, that will change in the future. We also want to bring national cancer survivorship leaders and educators to this greater Springfield area. We're very fortunate to have our speakers today who speak nationally and are known nationally, but we can even bring people from further away if we get more sponsors to help us fund this more. A little bit of some housekeeping here. There are some evaluations that we hope you'll fill out. It's very important that you do. One, because we can show sponsors that this is an important type of event. And two, if we delve into a little research, we can use the information you provide us to maybe get into the research world. If you have cell phones, please turn them off. Restrooms are in the center hall. We do have discounted tickets to the Basketball Hall of Fame if you wear your name tags. And now we have a message from a breast cancer survivor, Chicopee.
Good morning, everybody. Whether you are a cancer survivor, a caregiver, or a health professional, you have made a smart decision to attend Cancer Survivorship 101. Those of us who have taken that journey, we know you can't do it alone. So this morning, become more educated as you celebrate cancer survivorship together.
So the next part of the conversation that we're having today is about survivorship plans, otherwise known as survivorship care plans. I try to present terms that are not so difficult, so 2 words in my world is better than 3 words. So survivorship plans are a transitional tool from oncology care to primary care. I am sure more than 90% of you have never heard this term. It's something that's not well publicized, and we'll talk a little bit about that. So these are the major components of a survivorship plan. Cancer diagnosis, cancer treatment, complications of the cancer and the treatment, late effects and surveillance, and then other components. Complications can include any body system, heart, lungs, skin, special senses, gastrointestinal, urological. If you've had a stem cell transplant, there's something called graft versus host disease, which also can involve any body system. Late effects, again, any body system, and we're really privileged to have Dr. Nekledoff talk about that a little later on. The other components are things that are part of your daily life, but also complications of cancer treatment and being diagnosed a survivor. Behavioral health. In my opinion, most cancer survivors have a degree of post-traumatic stress. Effects on memory, fertility, sexual health. But we really can't forget the general medical screenings and general medical health, including weight, exercise, tobacco cessation, limited alcohol use, proper nutrition, and we'll have a great talk about that later today. And the basic screenings, mammograms, pap smears, colonoscopies, dental health, eye health, prostate screening. These are some survivorship plans. I can tell you that you can learn more about this if you go to the Survivor Journey's website and go to the resource page. There's also a component, primary care cancer survivorship program that I do in my practice in Springfield Medical Associates and the Enfield office. We have a lot of listed information that's included here that you can spend an afternoon looking at. The problem is that research is still being done on whether survivorship plans are an effective tool and are they cost effective. I look at this and I say they are a tool, and if we don't utilize something like this, what are we left with? Well, we're really left with nothing as a good transitional tool as you move along through your cancer journey, and that includes primary care. The problem with the survivorship care plans is they're really not mandated, and that your cancer center doesn't really have to provide it. There is an organization called the American College of Surgeons, which under it has the Commission on Cancer, which you don't even have to belong to as a cancer treating facility. But if you do belong, the mandate from them is that 50% of the cancer survivors have to be provided with a survivorship care plan. My issue with that, and I tell people all the time, is how do you decide who's among the 50%? How do you enforce that? One of my pet peeves is just that. It should be 100%. There are 2 hospitals in our local area that are accredited by the American College of Surgeons, and that is Holyoke Hospital and Mercy Medical Center. I can tell you I've never received a survivorship care plan from either hospital, nor have I received a survivorship care plan from any hospital in our area. And I can tell you the only hospital that I've ever received a survivorship care plan, that's not true. And from Dana-Farber, I have received a survivorship care plan. But the only other hospital is Cape Cod Hospital. So that we have a lot of work to do with that. I'm going to close with 2 vignettes that at some point I'm going to get on YouTube. The first is a cancer survivor sitting down with their oncologist. And the cancer survivor says, "What does my primary care doctor know about my cancer?" The second vignette is the same cancer survivor talking to their primary care doctor. And the cancer survivor says, "What does my chart say about my cancer?" And I'm sorry to say you will all be underwhelmed by the answers. The oncologist may say, "Oh, we send them notes all the time." Primary care doc will say, "Oh, we get notes all the time." The problem is that those notes that go to the primary care doctor get buried in the electronic health record. And if this information is not in every note, then it's not used, and it's not looked at. So I'm going to just turn for a second. So if this type of information is not in every note of your chart, it's not going to be looked at. My charts are like this, but people keep telling me I'm an anomaly. This is something you should ask for from your oncologist and your primary care doc. You have to advocate to get it done. It starts here. Thank you very much.